Ladies and gentlemen, on that note, I would like to call up Dr. Maurit Beeri from Israel. She is a distinguished pediatrician and the Director General of ALYN Hospital Pediatric and Adolescent Rehabilitation Center in Jerusalem, to please speak to us. So.
Thank you, ladies, gentlemen. I'm deeply honored and thankful for being here. This is my first time, my first day in India. So thank you for this very warm welcome. I am a pediatrician. I've been taking care of children with special needs for 25 years or so. And I can tell you that in my hospital, the hospital is led by women. All the management is women, and we do allow some men to assist us in certain positions. But it wasn't always that way in Israel. And I remember when I was in 4th year in medical school, I remember doing some kind of rotation and getting to a department where they looked at us and saw that half of the group were women, and they said, you can see that the prestige of medicine is declining, and that's why there are so many women there. That kind of talk is not acceptable. That kind of talk is the kind of talk that basically is driven by fear of replacement. Now, I don't think women are here to replace anybody. I just think that we not utilizing women is a waste of half of human potential. And if I could have my PowerPoint, please, I want to give you a little bit. This little kid, she's now 10 years old. She was born with severe breathing difficulties, and she was on a respirator, and she's now a healthy young person in regular school in society. And she's just one of many children that are cared for at our hospital. Please, could I have the next slide? But gender inequality, and these are numbers that I took from India, and I know these are for 2020, and India ranked 131 out of 189, but, can you click please? Israel just declined, down from the 60 to the 83rd percentile. What I mean to say is this struggle is never ending. We are not allowed to sleep on our laurels. We're not allowed to just sit back and say everything is fine, because we have a situation right now in Israel that we are being pushed back, and we will not take it. We've worked hard to achieve this point. I'm here to tell you people that I know that we're in a better position than some places, but it's not a given. It's a constant struggle. Could I have? So what happens in healthcare when there is gender bias? So it leads to worse care for women. Women are not getting the same kind of healthcare as men do. First of all, when women come to the emergency room in many places with pain, they're being told, oh no, it's nothing, you're hysterical. You know, the word hysteria comes from the word for womb, okay? So women's pains are not considered as rightfully so as men's, so they don't get the same management, they don't get the same kind of investigation. Moreover, the medical research, until about 1995, it was all done on males, and specifically white males between the ages of 20 and 40, which means that most humanity isn't included there. And the results from these tests, these medical research projects, exclude women. And this is one of the reasons that even though women suffer just as much from cardiac disease, especially after menopause, they're not diagnosed in time, and they get less care than men. And then there's the fact that when a woman is a lot of times afraid of the reaction, she's not in a safe surrounding, in a safe space, she could be harassed and bullied. So women think 3 times before they go to get medical care, especially if they have ailments that they feel ashamed to talk about, if they're talking about private parts, if they're talking about things that are not publicly acceptable, and especially in places where privacy is not expected and they think they might be exposed in some way to eyes that shouldn't be seeing. So they avoid themselves, we women avoid medical care. So, and if you happen to me from a subgroup who is also sidelined in society, from a socioeconomic group that is not acceptable, that if you have a sex orientation that's not acceptable, if you have another group affiliated, then you are doubly cited. And then these women within these, I mean, refugee women, minority women, they are not only excluded because they are women, but twice and sometimes 3 times. And if they have a disability to begin with, which is a whole other story about accessibility to health and disability, then it's a 3 hit. And women don't get the same kind of care. So gender, and this is the same point, okay? Oppression can happen anywhere, but in healthcare, because it affects everybody, it's even more pronounced. Thank you. But women are the caretakers of the world. And women take care. I mean, it's the, instead of taking professional nurses, women are the ones who most places around the world take care of the elderly, of the sick, of the people who need help. They are taking the burden of disease management in most countries of the world. And even so, in the healthcare positions, around the world, 70% of all nurses, of all healthcare professions are women, and 90% of all nurses and midwives. So not only are women not getting the same healthcare, but they're providing more healthcare than other, parts of humanity. But when you get to the leadership roles, that's where the gap starts, okay? Women don't get to the top position. They stay in the mid-level, and that's also true about Israel. It used to be that when I would go to a management conference of hospital managers, that was the only place in which the women's toilets would not have a line, right? You don't have to queue up because there were so few women. But it's changing. It's changing, and because it's not only gender bias, it's also because of the choices that we make ourselves. When we make a choice to bring children and to dedicate time to the children, it takes away from the time we work, and that is a proper choice that we're allowed to make. What I expect society to do is to help us bridge the gap and help us jump and achieve better positions later on. And I'm very lucky that I had the ability to do that. And I do believe that women management in health is, it's better. It's better because we are able to look at the larger picture and take into account a lot of different factors when we're talking about strategic management. I'm not going to say that every man is not a good leader. I mean, they're fantastic leaders. I just think that we could do better if just given the opportunity. So, and within healthcare, women take on more burden. They try to prove themselves more. They try to do more than everybody else just to make a point. I'm a woman, that doesn't mean I'm doing less. And they have more burnout, and they have more mental health issues. Thank you. So if we're talking about violence in the health system, this happens, people come to the emergency room, they're very, very worried about their loved ones. They sometimes lose control of what themselves, and they tend to attack the people that they think are in charge. And there's violence against women in healthcare everywhere. But the violence is just the tip of the iceberg, because the violence represents the outburst of ideas and presumptions and prejudices that are way deeper and beyond what actually comes out as that act of violence. So just dealing with the violence itself is important. It's incredibly important. It's not enough, because you have to start with the lower strata. You have to start with the gender bias. And this is from the British Medical Journal in 2020. So I'm also bringing scientific evidence. Thank you. So what can we do? It starts with this. It starts with talking about this, making this in the public eye, making sure that everybody knows that it's an issue. We have to educate, and we have to start very young, with young people, and with helping young women understand that they have a position, they have a role, and they have the ability to not only provide care, but also they're entitled to equality in care. We have to make sure that every type of research is diverse enough to include women. And we have to be accountable. As management, as leaders, whether you're male or female, you have to check yourself all the time. Make sure you're not making the mistakes. Make sure you're taking into consideration things that are taken for granted. Treatment guidelines around the world, they have to make sure that they take good care of women in whatever condition, in whatever stage of their lives, and policies. If you have a policy in the workplace that does not allow harassment, mismanagement, that just like we heard that what is happening in Mexico and Costa Rica, makes sure that women are pushed forward, at least that they can try for the same positions. I'm not saying take the woman who's not as good as the man. Take the better person, but make sure that women know how to present themselves, have the self-assurance to talk, because women a lot of time are shyer, especially if they don't have the backing of their family and the society around them. You have to push them to put themselves forward and say, yes, I can. Self-advocacy. This is what we're doing here. This is why we're here. I think this has to go a long way, and I wish us all great success in this. And thank you very much.